Hi, my name is Maddie, and right now this patient has a Foley catheter inserted, and I have from the doctor's orders to do a urine specimen collection and a removal. So I come into the patient's room after I've gathered all my supplies, and I introduce myself and I make sure that the patient knows who they are. I ask their name, their date of birth, and also look at their hospital bracelet. And before I do anything, I'm going to look at the tubing and make sure that there is urine in the tubing, and if there isn't, I would wait 15 to 30 minutes, and I'd come back to make sure that there is urine in there. But for testing purposes, there is. So I'm going to take the tubing, I'm going to clamp it. And I'm going to clean off the port. I'm going to go in a circular motion for 15 to 30 seconds. And I'm going to take my needle, put a 10 milliliter 25 gauge, and I'm going to go at an angle and withdraw whichever amount the doctor has prescribed. Usually it's going to be about 3 to 5 milliliters. I'm going to make sure that I'm holding the cap downwards. I'm going to release all of it into there. And once I'm done, I'll put the safety on. And I'm going to put the patient's label in here and put their name, the date and time it was done, and send that down to the lab within 15 minutes. So that's done for the specimen collection. Now the doctor has also ordered to do the removal. I'm going to grab a napkin just to put under to catch any of the patient's or any water or anything that comes out. I'm going to take my syringe and hook it up, and I'm also going to note how much is inserted into the balloon to make sure when that all comes out. So I'll let all the water come out, and after that is done, pull the catheter out carefully, making sure, and slowly making sure that I don't hurt the patient. Once it is all out, I'm going to hold it out, making sure that everything is intact. Once that's done, I'm going to discard up everything into the biohazard bag. And then if the doctor also ordered to do any irrigation, I would check in the notes to make sure I have the right type of solution, the right amount of the solution. I would gather all of my supplies and I would come in. Again, I would identify the patient with their name and their date of birth. I introduce myself, and I would come again with put new gloves on, come with the alcohol prep, and I would clean the port. And then I would clamp the tubing, making sure again that if there was urine in it, or if there wasn't urine in it, I'd come back within 15 to 30 minutes and then I'd clamp it. So the tubing would be clamped, and then I would come in with the port after it's cleaned, and I'd come in with the port with the needle at an angle and inject all of it in there, making sure that it goes in the catheter. And then once that's done, I would unclamp the tubing and make sure that everything came out and drained into the bag. And then I would also put in the nurse's notes that how much the solution I put in there, so that at the end of the day when they're done calculating the INO, that they can subtract that solution from the tank.